Jon, thank you so much for joining me today for a Corona conversation. If you can maybe let people know where you are in the world and what you do for a job and where you're calling from today.
Yeah, hi Adam, it's good to join you too. So I'm Jon Goldin, I'm a consultant child and adolescent psychiatrist at Great Ormond Street Hospital, and I'm also the vice chair of the Child and Adolescent Psychiatry Faculty at the Royal College of Psychiatrists.
So an expert in your field, but people watching this might be going, yeah, but why are you talking to a child psychiatrist when we're talking about drugs and coronavirus? And actually, the reason I wanted to talk to you is that lots of the people watching this will have kids, and lots of the people we look after will have kids. And I think it's really easy to forget the potential impact of what's going on children. And so what I wanted to ask you about today was tips to give parents around how do you have those conversations with kids around coronavirus? What's your starting point? Where'd you start?
Well, I think it's really important in the current climate to be honest with children about what's going on. I think a lot of children will be anxious, a lot of adults are anxious, and we're getting a 24/7 news cycle about coronavirus for obvious reasons. So I think children will be picking up on that and will have questions to ask. And I think it's really important to sort of take your lead from the child. So when they do ask you a question, try and make time to sit down, to listen to them and to answer their questions as honestly as you can. I think, you know, often we're quite stressed as adults as well. So we need to try and be calm and reassuring as far as we can. If we're not in that kind of space, perhaps, you know, come back and talk about it at another time when things feel maybe slightly less hectic for the adult concerned. I mean, when you're talking to teenagers, it's often useful maybe to talk in a car. That's often when they might be asking you a question. You're not necessarily looking face to face at each other. You might be looking forwards. That can be quite a good way to have a sort of honest, quite open conversation with your teenage son or daughter, but not necessarily in quite such an intense kind of face-to-face situation.
Okay. And what about kind of having the news on in the background? Kind of, you know, 7, 8, 9, 10-year-olds running around. Should we have the TV and radio off because we don't know what nightmare is going to appear?
I think it's really important to be cautious about the news cycle that we were just talking about earlier. I think it can raise anxiety if the news is on constantly. So I myself am trying to watch the news, you know, once or twice a day, or listen to it once or twice a day rather than have it on constantly. And I think for children, that's particularly important. So, you know, when a child asks you about coronavirus, I think it's important to, you know, give them the honest facts. So rather than just say, sorry, Adam, I just got a phone call. This is going to be edited, is it?
Yeah.
Yeah. Okay.
Well, we can chop a bit out, so it's fine.
Yeah. Yeah. Sorry. Switch off that. Okay. So when a child asks you about coronavirus, they're going to be often quite anxious. And I think it's important not to sort of falsely reassure them and say everything is going to be absolutely fine, there's nothing to worry about, because we are in a very unusual global situation at the moment. So acknowledge their anxiety, acknowledge that you as an adult or as their parent, you're also feeling somewhat anxious, and that's okay. But also reassurance is really important, accurate reassurance. So for example, saying to a child that when children get this illness, they get it rather mildly. They don't get severe symptoms. If they've got pets, you can reassure them that the pets won't get the symptoms, and that there are ways that we can, you know, take some control over this. For example, by washing our hands regularly, by self-isolating as appropriate, by keeping a sort of secure social distance when we're going out, as we're being advised to do. So this is not something that we're out of control of. We do have ways of controlling it. There's particular worries, obviously, for 70, 80-year-old people, might be grandparents, and I think it's worth being honest about that. In the case of my children, for example, they know that their grandparents have been particularly careful about self-isolating, and they're getting support from family and friends not to need to go to shops, for example, in crowded areas. So being honest about the kind of precautions that we need to take, but also being kind of calm, reassuring, and helping them understand that we will get through this. This is not going to go on forever. Over the next few months, this will go away, and that we've got lots of intelligent, clever people working on this, you know, health professionals, scientists, etc., who are, you know, seeking a vaccine, seeking the various antibody tests and so on. And we will get through this as a society together.
So one of the groups that you work with all the time are anxious teenagers. And I'm just wondering, for those younger people who've already got a pre-existing mental health problem? What's the impact of COVID been on them?
I think if you've got a pre-existing mental health problem, it obviously depends on you as an individual, but it can go in different ways. If you've got, for example, obsessive compulsive disorder, that can definitely be exacerbated. And I've got patients who are in that situation. So we're getting constantly told to wash our hands more frequently. And if that's one of your primary symptoms, obviously that can be worsened by being told how important it is to wash your hands. So that's one aspect. I think if you're an anxious person, paradoxically, it can sometimes reduce anxiety because you don't feel so isolated with your anxiety, because everyone's somewhat anxious and everyone has a kind of reason to be somewhat anxious. So in some cases, anxious people feel a little bit more part of society, as it were, and feel less separate themselves.
Now you know how I felt all these years.
Exactly. You put it very well, Adam. And I think we've noticed as well that fewer people in some ways are turning up to A&E departments at the moment. I think people are kind of somewhat protective of the health services. They know that people are under pressure. I do worry a little bit that some of these difficulties might be going a little bit under the radar and will surface more, in the medium term, but we'll see. I think also people are in confined environments at home, so with their family and friends. So that's, well, family particularly, less likely friends, but they're confined at home in unusual circumstances. So I think it's really important to think about how to manage that. And if you're in a family where, unfortunately there might be some degree of domestic violence or significant conflict, obviously that is a real concern if you're self-isolating in a family like that. So we are concerned about children in those sort of circumstances. I could talk a little bit about how to manage being at home, if that's helpful.
I think that'd be really helpful.
Yeah. So for example, things like structure and routine are really important, making sure that you've, got something to do during the day. And that could be a mixture of, for children, homework, reading, a bit of studying, but then also, watching TV, some social media, some games with their family, trying to connect with people around you. So one of the good things about young people is they're very connected on social media via their phones, etc. And that is a good way of staying in touch with your friends. So lots of families today are having conference calls. We're having this conversation via Zoom. There's lots of different platforms that you can connect with face to face and stay connected with your family and friends. So as I would say, structure, routine, a calm atmosphere as far as possible, doing things that you enjoy, but also having breaks. So, at the moment we are absolutely allowed to go out and get fresh air, get exercise every day, as long as you're maintaining at least 2 meters distance from other people. So I think that's an important thing to do as well. Make sure you get some exercise and fresh air. And of course, online exercise videos and things like that are booming at the moment. So, that can be very helpful. My father's in his 80s and he's doing an online Tai Chi class. So, these kind of things can continue despite our circumstances.
So the final thing I want to ask you is that I think a lot of people who are generally robust and they've got good mental health, being banged up with your kids all the time is enough to drive any sane, normal family to distraction. And yeah. I certainly worry that between parents where friction occurs, it's going to be taken out on kids. And I just wanted to know if you had any tips for parents watching this about how to be conscious that they're around their kids more than they've probably ever been before. Their kids listen and pay attention to everything. How can we as parents become more self-conscious of the impact that arguments we might be having or stresses we're experiencing don't get filtered down to our kids?
Yeah, well, I think the adults in the house, so it's a really good question, Adam. I think the adults in the household need to really look after their own mental health and make sure that they are taking the kind of breaks that I've just been talking about, that they're getting fresh air every day, that they're getting exercise, that they're trying to do things that they enjoy doing. Sometimes it's a one-parent household, sometimes it's a two-parent household. Obviously, if it's two parents, you've got a bit more of a chance to kind of have breaks and maybe one parent takes the lead while the other one has a little bit of space. But yeah, I think it's about looking after your own mental health, trying to be calm, being very, children are extremely attuned, as you've just suggested. So if the parents are arguing or there's a lot of tension, the children will pick up. They'll pick up on that atmosphere. So of course, it's easy for me to say, be calm, be reassuring, but that is really what is very important to try and do as far as possible. And different adults will have different ways of managing their own stresses. So try and think about for yourself what you find particularly helpful. It might be reading, it might be watching a movie or a video, it might be playing a game, it might be going out and going for a run. You know, whatever it is that you find helps you manage your stress is so important at this time to support your children in the household as well.
And hopefully that's not picking up another bottle of vodka or scotch, because being drunk in charge of your children is going to make you less aware of your emotions. And, you know, you need to kind of keep yourself together for your kids.
Absolutely, of course, yeah. Yeah.
I mean, some people watching this, John, will be in lockdown where they won't be allowed to go out. They won't have that luxury. And one of the things you spoke about was structure. So I just wanted to ask you, so within psychiatry, where people have got obsessive worrying and things, we sometimes talk about worry time. Give yourself that 15-minute period where you can worry, write down your concerns. Do you think there's any value in saying to families that, you know, there's corona time, there is time within the day where we do a catch up on things that have upset us in the household, or even just an update on corona, so it can be protected within that little box, as opposed to infiltrating every moment of our waking life?
Yeah, I mean, that's an interesting idea, Adam. I think different families will manage it in different ways, but I think that's certainly one strategy that is a possibility that could be very useful. So I think open communication is key, honest, open communication. I think I also wanted to mention there's quite a lot of misinformation out there, and children will be seeing things online that is not necessarily accurate, you know. And unfortunately, there's an element of racism that can be around, or blame, this kind of thing. I think giving the message that really we are in this together, this affects all nationalities, religions, etc. And this is not, it's not one particular part of the world that is to blame or anything like that. And I think that's a really important message to get across as well. And another quick thing, just to build on your suggestion about corona time, you know, maybe journaling is a helpful way of doing things. You know, spending some time writing down your thoughts, keeping a diary, that can be a very useful way when you're relatively in isolation of how to manage your thoughts and feelings. And then you might want to share that with your parent or your brother and sister, or you might not, but actually having some space, maybe 10 minutes, 20 minutes a day to write down how you're feeling, that can be a useful strategy.
You know, we've been keeping a daily kind of corona video diary, just checking in with each other, but also as a way of, I think, getting rid of some of our own frustrations and concerns, but also saying, hey, some things are still normal. We're still having chicken soup for dinner, or whatever it is. It's like, you know, you can retain some normality at this time.
Yeah, absolutely. Another one that just comes to mind is like music, you know, listening to music, playing a musical instrument if you're lucky enough to know how to do that, learning a musical instrument, you know, these kind of things that you might not normally have as much time to do, you can potentially catch up on. Tidying up at home, you know, having a bit of a clear out.
That's on our list.
Opportunities.
That's on our list for sure. And I'm sure every child watching this will be over the moon that the opportunity of tidying has been offered by their loving, generous parents. Yeah, we've got our kids really into tidying drawers and organising them. And long may that delusional belief last that this is a source of pleasure and fun. So,
Sounds like you're doing a good job, Adam. Yeah, I think it's challenging for all parents, basically. And as I say, in each family, people will manage it in different ways. So you need to try and find the way that you can manage as best as possible, and talk to your kids about things. Have honest, open conversations with them. And, you know, it is actually, I'm hoping that we'll come out of this a better place, you know, in a better place as a society. You know, we are all very interconnected. I think one of the things that's been happening over the last year or two is that there's been a rise in sort of like dealing a slightly more selfish way of looking at things. You know, let's look after number one kind of thing. But I think what this coronavirus epidemic is showing us is that we are so interconnected, and we do rely on each other. And there's so many positive things that are happening as well. In fact, children can support, you know, elderly neighbours, whatever, offering help with shopping, that kind of thing. They might have an opportunity to do things that they wouldn't have done before. Excuse me. That's one.
Yeah. All right, John.
Make them feel useful.
Absolutely. So look, thank you so much for taking the time, sharing those tips and things. We may come back to you in a month or two's time, maybe to get an update on other things that you've learned, but also to keep an eye on the impact of COVID-19 on young people's mental health, because that doesn't go away just because, you know, we've got a virus. Everything that makes us ill is still there. So it would be good to maybe follow up. So thank
I'd
you.
be very happy to do that. Thank you, Adam.
And so the question that you chose to ask, will it be better where we're going? And though the answer I don't know for a fact, still my heart is saying, oh yeah.
Still just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine.